Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide commentary and education on all sorts of sports and exercise injuries so that you can stay healthy and perform your best. One of the most common injuries that require surgery in all of orthopedic surgery, all of sports medicine, are ACL tears, ACL injuries. That's the anterior cruciate ligament in the center of the knee that provides stability to the knee. We think that somewhere between 100,000 and maybe as high as 200,000 of these surgeries are done every single year just here in the United States. And so it's very, very common. And that surgery involves not sewing the ligament back together, but actually making a new ligament. We harvest a graft, basically take tendon or ligament from another part of the knee and use it to make a new ACL. And I get questions all the time about what type of graft should I get. Should I use the middle part of my patella tendon? Should I use one or two of my hamstring tendons? Or should I even use a donor, a cadaver tendon, or an allograft? Now, in a big sense, this is really bigger than I can answer in any one Ask Dr. Geyer video, but there's a very specific question about graft options and which graft to choose for ACL surgery that I think would be very helpful. So in this Ask Dr. Geyer video, I'm going to discuss knee pain when it comes to which graft should I use. Christina asks, my 16-year-old daughter tore her ACL and MCL during soccer while playing the field. We have done much research and we're leaning towards the patella tendon graft. However, it recently was brought to our attention that this type of surgery is not recommended for people whose work requires them to be on their knees. Her main position for club soccer is goalkeeper, and I'm wondering if this is the best option or if a different graft option would be better for her. It's a terrific question, and so what she's getting at, the patella tendon is the tendon just below the kneecap, and it helps to straighten the knee. It's probably the most common option used for ACL reconstruction. You harvest about a centimeter wide section of the patella tendon and a little piece of bone on either side. That's why you may hear it, if you ask your orthopedic surgeon, you may hear it called bone patella tendon bone. That basically you use the patella tendon or the middle part of the patella tendon as the part that becomes the ACL ligament, but the bone on either end is what the screws hold in place, and so you have bone healing into bone. We like it because it's a very strong graft. It's probably got the quickest incorporation time, but it does have some downsides. In a general sense, the one that people complain about is what we call anterior knee pain, or pain in the front of the knee, and we think somewhere maybe 10-15%, maybe as high as 20% of people get that, but we typically do use that graft, especially in very active people. Now, what Christina is talking about is a specific subset of pain, and that's pain directly kneeling on the patella tendon. The patella tendon heals in. You basically put stitches in after you harvest the middle part, sew it back together, and it does very well. But what she's talking about that she's heard, and it's a real phenomenon, people that do a lot of work on their knees. So you're thinking about carpenters, you're thinking about maybe mechanics, people that do manual labor where they're kneeling a lot as part of their work and they're putting pressure directly on the graft. I think you can make a pretty compelling case in that scenario. Maybe you don't use the patella tendon, maybe you use the hamstring, one or two of the hamstring tendons as a graft, so that you don't have discomfort, 6 months or a year or years down the road with harvesting the patella tendon graft and kneeling directly on it. Another group that sometimes we think patella tendon, and this is controversial, but patella tendon grafts maybe aren't the best thing, are people that do a lot of repetitive jumping, competitive volleyball, competitive basketball. I'm not sure I'm in that camp. I like the strength of the patella tendon grafts, and personally, for high-level athletes, that's what I like to use. But there are people that feel that for jumping athletes, maybe a hamstring tendon graft would be better. The goalkeeper, there is some jumping, there is some, potentially you fall and land on your knees, but generally my thought would be that it's an acceptable graft option. Not that a hamstring graft isn't an acceptable option, but I think that you could make a case for either of those. I don't think playing goalie though, and generally sports overall involves that much kneeling where your knee is constantly on the ground, so I don't know that there's a contraindication or an absolute indication not to use a patella tendon graft. Having said that, real quickly, this is a bigger topic than I can get into here, but I've talked about it in other Ask Dr. Geyer posts and videos. I think for competitive athletes, I still think autografts, either patella tendon or hamstrings, are certainly better than using allografts. Lower failure rates, all sorts of other issues, just personal opinion, but there's some pretty good data about that. There are some uses for allografts, but I don't think competitive athletes are certainly one of those. Now, have you had an ACL injury and are you trying to decide what graft to tell your surgeon you'd like to use? Or maybe you've had ACL reconstruction and you had a patella tendon graft, or you had a hamstring graft, or a cadaver graft, an allograft. I'd love to hear your experiences. So below this video, leave your comments. I'd love to hear what you used, your experiences with it. I think it can really help other people watching. Now, if you like these videos and you want more information on injuries and injury treatments and injury prevention in sports and exercise, you subscribe to my video channel. I record 1 or 2 of these videos every single week, and I'd love to deliver those directly to you. Now, if you know someone that has an ACL injury, maybe you don't, but maybe they have one or they have friends that have one, I'd really appreciate it if you'd share this video with them as well. And last, I record, I share, I write so many resources on ways to stay healthy and perform your best, completely free, but a lot of those I only share with my email list, with my email subscribers. So go to my website, drdavidgeyer.com, enter your name and email address right at the top of the website, and you'll get those resources on a regular basis. I'd love to connect with you that way. Thanks so much for watching. Again, if you've had an ACL injury, I'd love to hear your experiences or questions with ACL graft options, and I look forward to seeing you right here next time.